Hello, everybody, and good morning, because it's still morning here in Sweden, where I'm based. And thank you very much for this opportunity to present our research. So the title of our paper is the GDPR compliance for blockchain applications in healthcare. Firstly, I can just make a brief presentation of myself. I'm a PhD candidate in medical technology at NTNU. It's the Norwegian University of Science and Technology. I'm doing research mainly on blockchain applications within the healthcare sector. And my background is in public health. So I have a health science background and not so technical background. So I'm looking into more of the usage and the application of this new emerging technology of blockchain. So I will start this talk with just a brief introduction of blockchain, because it might be new to some of you who are listening. So blockchain is probably most famous with the cryptocurrency called Bitcoin, which were introduced over 10 years ago. And in recent years has gained a lot of attention. Well, the crypto field really spiked in 2017 with the value of Bitcoin and other cryptocurrencies really increasing, and then the technology of blockchain also have gotten a lot of attention since then. And there's actually a lot of research now going on blockchain applications within the healthcare sector. So what is blockchain? So basically, it's a ledger of data entries that is distributed among a lot of nodes in a network. And so some of the characteristics that the blockchain gives is that you could get an immutable ledger. So you could be pretty sure that the ledger hasn't been tampered, or the entries in the ledgers haven't been tampered with if they are accepted into the networks. This depends a little bit about how the blockchain is designed, but mainly there is no central authority in the blockchain, so it's a completely decentralized system. It relies heavily on cryptography. What you can imagine, each block of data entries is cryptographically connected to the next block, and that makes sort of a immutable trail of data entries. The users of the blockchain can be anonymous to certain degrees. One issue with blockchain and blockchain research is that we don't really have a fixed definition of what this technology is. So the definition tends to vary quite a lot depending on who is using the term. So to clarify what we mean with blockchain in this research, we have defined it as follows. So blockchain is a distributed, decentralized, and tamper-proof ledger without any centralized control. So this is our definition, and I believe this is a definition that many others use as well. But if you have come across this field before, you know that blockchain is a term that also be used for various type of systems. Many of them is very centralized. So I believe that there's many who like to ride on the wave of this attention that this word brings. So they call solutions and systems that are not really new in any way blockchain to maybe get some more attention. But that's just my personal opinion. What I do believe about this technology is I usually say it's more about the people who use the technology than the technology itself. So if you look in detail in the blockchain that were introduced with Bitcoin, you can see that there's nothing really new technical components that were presented in this white paper that the founder of Bitcoin presented. So it's basically just he put together, or they or she put together, a lot of ideas and cryptographic innovation to form Bitcoin. So they didn't really introduce anything new, but the real innovation was rather that it worked and people trusted the system that they built. And the governance of the network, I think, was the real innovation. So people trusted the value of Bitcoin, and they trusted that the governance of the network would work and nobody would try to tamper with it. And it has actually been proven now for over 10 years that it has been working quite flawlessly, and it's quite amazing. So then, introduction to our research work. One main objective against blockchain, especially in the healthcare field, is that how would it comply with the current regulatory frameworks? And the healthcare industry is surrounded by regulatory frameworks for good reasons. Two of the frameworks is GDPR and HIPAA. GDPR, you may have heard of before. This is the general data protection regulation in the EU that covers not only health data, but all data, really, or all privacy privacy data. HIPAA is the sort of the American version or the US version of GDPR, but only covers healthcare data. And GDPR in healthcare is a very important topic, but I should also say that GDPR is not the only regulatory frameworks that regulate your health data. We do have usually we have national health data regulations and health data laws, and a lot of times these laws are standing above GDPR. So some of the articles in GDPR may not be relevant for healthcare data. As an example, you could think of your medical journal. So at least in Scandinavia, it's not allowed to delete a patient's medical journal or the entries in a medical journal, which is then a little bit goes against GDPR, which have one article that says that you should have the right to erase your personal data. But then this health data laws in Scandinavia sort of stands above this article in GDPR. When GDPR was started to be developed a few years ago, they didn't really consider blockchain as a technology, since it was very new back then and it was not really widely adopted. DLT here stands for distributed ledger technologies, which is also a form of blockchain technology. So what you can see in healthcare is that blockchain has several relevant use cases for tracking data in a network. We have an ongoing trend that it seems that people and the society want to regain control of our personal data. Probably after the scandals of Facebook with Cambridge Analytica and so on, you realize that your personal data is very valuable and it could be used for a lot of things that you are not comfortable for it to be used. And I think this is particularly true when it comes to health data. So you don't want to have your health data used by anybody who use it for the wrong reasons. So the objective of our research was twofold. So first of all, we want to look into some different designs of blockchain and explore how the GDPR compliance different for different designs of blockchain in healthcare. And the second objective was to provide guidance for future researchers how to comply with GDPR when they design a blockchain system for the healthcare domain. And basically, there's three problematic areas for GDPR and distributed ledger technologies. The first one will be the accountability. So basically, GDPR says that we need to have a data controller. And it's very difficult in a decentralized network that's supposed to be that not supposed to be controlled by anyone, that have a data controller. The second one is the anonymization of personal data. So we can anonymize data in different ways, and we can do it in different degrees. And it's not really clear in the GDPR how much you need to anonymize the data to call it anonymized. And the third one is the right to remove or erase personal data, which is obviously conflicted with the immutable ledger that technically can't delete data. So the main results of our research is we looked into 4 different kind of blockchain concepts that were targeting different use cases in the healthcare sector. These 4 blockchain concepts were different in design. So we have both private and public blockchains among these 4, and we have some other different design choices that the developers had made. Although we saw that the 4 systems really were in line on most articles in the GDPR, so they complied on the same and they didn't comply on the same. And the 4 that you can see in the screen here is the main 4 that they didn't comply with. And as you may recall from the previous slide, you have the right to be forgotten. You have the lack of a data controller, which is the 2 you see to the right, is 2 of the articles that none of the 4 concepts were complying with. And 2 others was the Article 33 and Article 34. So none of the system had implemented a system to notify a data breach. This is actually could be quite a simple solution to add this to a blockchain network or system. So this should definitely be able to comply with this Article 33. We do think that the developers haven't really considered this when they're designing their system. Sorry. And then we have Article 34. So the communication with the if a data breach occurs, you should communicate this to the data subject. This could be a bit problematic if you don't have any channels to communicate to the data subject. For example, if all the data is anonymized and all the entities that interact with the blockchain is anonymized, it's very difficult to then establish these communication channels. Yeah, and the first point here, as I already said, so you could implement what is called a smart contract. So the blockchain then automatically could send a notification to the relevant authorities when a breach is detected, if a breach is occurred in a blockchain system. And for the other article, developers should consider to have a designated person to be the data controller in the network. This is again a little bit problematic, since the whole idea with the blockchain is that it's supposed to be decentralized and nobody should have, or no single entity should have control over it. But I mean, to be able to comply with GDPR as it is today, I think you should, especially if the network is run by sort of a, or if it's created by a company, for example, I think that company should have a designated person to be the data controller. Some discussion points. So what we could see from our research is that no blockchain platform is GDPR compliant out of the box. So you can't just take one framework that exists or platform that already exists and say, okay, this is GDPR compliant. So it's how you build upon the framework and how you utilize the different attributes that the platform or frameworks gives you. We do believe that it's possible for both public and private blockchains to be GDPR compliant in healthcare. It's very much up to what kind of data that you place on the blockchain. For example, if you only place metadata and completely anonymized data on a public blockchain, we don't really see any benefits of using a private blockchain in terms of GDPR compliance. The degree, as I mentioned earlier, the degree of anonymization is very important, and I think here we need to have a clarification from the authority. So, to what degree do we need to anonymize data to call it anonymized and be compliant with GDPR? As I mentioned, consider to store only metadata and maybe hash pointers on chain, so meaning on the network. So this is data items that are not considered to be private data. So they shouldn't then be under the GDPR. And it's important to remember that GDPR is meant to protect our data and not stand in the way of innovation. And especially when we have a new technology that could actually improve our data privacy by sort of technical solutions. GDPR should not stand in the way to let this happen. So basically GDPR and blockchain to some extent want to fulfill the same purpose, that is to give our data privacy back to us as citizens. And I think I finished my talk with that, and I can open up for some questions.